Good afternoon, and thank you to the moderators and to Stages for allowing me to present this afternoon. My name is Dr. Stephanie Joseph, and I will be presenting on loop duodenal switch confers more complications with little gain of weight loss compared to Roux-en-Y gastric bypass. These are our disclosures. So the biliopancreatic diversion was first described in 1979. It's a procedure that was used to combine the restrictive format of a gastric sleeve with the malabsorptive properties of an intestinal bypass. It was extremely effective at achieving weight loss, however, it resulted in a high incidence of complications. This procedure has undergone various revisions of its method throughout the years. Here's a schematic that shows on the left the 1979 procedure and the more frequently performed procedure today. However, despite these modifications, the duodenal switch is still not frequently performed. A 2021 MBSAQIP database noted that less than 1% of bariatric cases were duodenal switch procedures. A survey of bariatric surgeons cited multiple reasons for that, one being that the complexity of learning the procedure and the learning curve was a deterrent, and secondly, that the knowledge of understanding that the procedure does have increased risk of complications. A 2021 paper that followed patients for 60 months showed that the total body weight loss in the loop DS category did have significantly more weight loss. However, when looking at the 30-day complication rates, there's much increased complications compared to the Roux-en-Y gastric bypass versus the sleeve. And then a 2011 paper sort of mirrored that same sentiment with having a higher morbidity in the loop DS patients as well. So the purpose of this project is to offer a comparative analysis of Roux-en-Y gastric bypass and loop DS at our institution with up to 4 years of postoperative data. We completed a retrospective review of our bariatric database. We included patients who underwent Roux-en-Y gastric bypass and loop DS from 2019 to 2023. We collected demographic, preoperative, postoperative data for up to 4 years. We also sent out quality of life surveys, and these patients were able to complete those surveys, and a statistical analysis was completed. At our institution, we perform a duodenal switch. The gastric sleeve is performed over a 40 French bougie. Our common channel is 250 to 300 centimeters, and we perform a hand sewn anastomosis. So on to our results. We had a total of 238 patients who'd undergone Roux-en-Y gastric bypass and 54 in the loop DS category. Our initial BMI was significantly more, with our loop DS patients having a higher initial BMI. Other demographic information was not statistically significantly different. Looking at comorbidity, preoperative comorbidities, there also were no statistical significant differences. The ASA classification of 3 or 4 OR time and length of stay were statistically higher in the loop DS category compared to Roux-en-Y gastric bypass. There were no differences in intraoperative complication. Now looking at our post-op 30-day complication rate, our loop DS category did have 16.7% complications compared to the Roux-en-Y gastric bypass group, which was 7.1%. Here we listed our complications that we saw within our patient population. Moving on to postoperative comorbidity resolution, we did not see any statistical significant differences in any of the postoperative comorbidities. However, when we looked at the prevalence of GERD in the population, the loop DS patients did have significantly higher GERD symptoms compared to those in the Roux-en-Y gastric bypass category. Now moving on to our percent total body weight loss. We noted that at 2 years, the loop DS patients did have significantly higher weight loss at 44.6%, and the Roux-en-Y gastric bypass at 34%. However, this was lost on year 3 and year 4. We completed a subgroup analysis with patients who had initial BMI greater than or equal to 50, and we did not see any statistically significant weight loss in any of the postoperative time points. At the bottom, we did put the N number of the patients that did return and that we had data for at each year, and we did note that year 3 and year 4 did have much lower patient return rates. And this schematic is showing the excess weight loss and essentially showing the same thing, that we did not note any postoperative weight loss at any year differences in postoperative weight loss at any time point from year 1 to 4. And in our subgroups analysis, we did note the same thing. This here is showing our quality of life data. We had GERD HRQL questionnaires, as well as a surgical outcomes measurement systems questionnaire sent to our patient. And looking at GERD HRQL, pain impact, bowel function, and satisfaction, there were no statistically significant differences between the patient. So in conclusion, patients who undergo loop DS at our institution are more likely to experience postoperative complications compared to roux-en-y gastric bypass, with a marginal added benefit of weight loss or comorbidity resolution up to 4 years post-op. We do have some limitations. This was a single institution study, a retrospective study. There's potential for selection bias in which category patients were placed in. We did note that we did have a low follow-up rate in the later years at 3 and 4 years, and also a learning curve. So all of our surgeons who completed the loop DS, their first, second, and third patients were included in our data. And thank you. I'm open to any questions.